Hello everyone, my name is Dr. Pradeep Shenoy from Pacespro. Now we are going to do a series of lectures on Mrcp Part 1 exam. Today's topic is on rheumatology, Introduction to Rheumatology. As we know, rheumatology is a subject which deals with diseases of the bone, joint and the muscles. Broadly, rheumatological diseases can be subdivided into 5 categories of diseases. The first one is the metabolic bone diseases. As we know that the bone consists of two components, the matrix component which gives the strength to the bone, and we have mineral component which is made up of calcium. So if the matrix component is deficient, it is called as osteoporosis, where the bone will become weaker, and which is diagnosed by DEXA scanning, which is characterized by T-score of less than -2.5. In osteomalacia, we have the mineral component is deficient. The commonest cause is vitamin D deficiency. Then we have arthritis, which is broadly divided into inflammatory and non-inflammatory arthritis. So we'll be discussing about this in subsequent slide. Then we have connective tissue diseases. Connective tissue diseases are characterized by multi-system involvement and presence of a specific antibody. We have systemic lupus erythematosus, which predominantly involves skin, joint, and internal organs. And we have positive anti-nuclear antibody, specifically anti-double-stranded DNA and anti-Smith antibody. Scleroderma is a condition which predominantly affects the skin with or without internal organs. And we have anti-topoisomerase antibody and we have anti-centromere antibody. Vasculitis is a disease which involves various blood vessels, and depending on the size of the blood vessel, they are further classified as large vessel vasculitis. Example is giant cell arteritis. Then we have medium vessel vasculitis. Example is polyarteritis nodosa. Then we have small vessel vasculitis, which is consisting of granulomatous polyangiitis, also called as vaginous granulomatosis. ANCA, also known as anti-neutrophil cytoplasmic antibodies, are specifically seen in small vessel vasculitis. Then we have regional pain syndrome. The commonest example is carpal tunnel syndrome, where the person will have a wrist pain. It's due to median nerve compression at the flexor retinaculum at the wrist. The common causes for Mrcp exams are acromegaly, polycystic ovarian syndrome, hypothyroidism. Then we have epicondylitis, where there's a pain in the lateral epicondyle, also called as tennis elbow. Arthritis, as I discussed earlier, it is broadly divided into inflammatory and non-inflammatory arthritis. Now, when do you say as inflammatory arthritis? Inflammatory arthritis are associated with the joint stiffness that is usually for a period of more than 1 hour in the morning, and the stiffness decreases with the activity of the joint. And when you examine them, the joints are tender, they are warm, and they are swollen. The patient might have systemic symptoms suggestive of inflammation such as fatigue, fever, and loss of appetite. Once you have labeled the arthritis as inflammatory, it can be further subdivided based on the etiology. We have crystal-induced arthropathy, example is the gout. Then we have infectious arthritis, example is gonococcal arthritis. Then we have seropositive and seronegative arthritis based on the presence of rheumatoid factor. Classical example of seropositive arthritis is rheumatoid arthritis. The classical example of seronegative arthritis is ankylosing spondylitis. We'll be discussing about each one of them in detail in subsequent slides. With this, we'll come to the end of Introduction to Rheumatology. Thank you.